stop. Before you take your evening pills tonight, watch this first. I want you to picture something. You walk into a room and have absolutely no idea why you came. You're introduced to someone and forget their name before they finish saying it. You reread the same paragraph 3 times and it still doesn't stick. Most people chalk that up to getting older. Doctors tell you it's normal. Your family quietly starts to worry. But what if it isn't age at all? What if the answer is sitting in a little orange bottle on your nightstand right now? Today, we're going to talk about 9 medications, some of them shockingly common, some available without a prescription that research directly links to memory loss, brain shrinkage, and accelerated dementia in people over 60. Stay with me all the way to number 1, because that's the situation that affects the most seniors. It's almost never discussed, and it may already be happening to you or someone you love. I'm your host on Senior Health Revealed, the channel dedicated to giving you the honest, research-backed health information that too often gets left out of a 10-minute doctor's appointment. If you haven't subscribed yet, hit that button now, because this is exactly the kind of video we make every single week. Let's get into it. Number 9, diphenhydramine, Benadryl. We're starting with one of the most trusted names in any pharmacy, Benadryl. It's in almost every medicine cabinet in America. People take it for allergies, for colds, for sleep. It's cheap, it's easy to find, and most people assume that if it's sold over the counter, it must be harmless. It isn't. Not for your brain. Diphenhydramine belongs to a family of drugs called anticholinergics. What that means in plain English, it blocks acetylcholine, the chemical messenger your brain uses to form new memories and stay alert. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia compared to those who didn't. Your brain becomes less and less efficient at creating new memories, and you may never connect it to that little pink sleep aid you've been taking for years. What to do? Ask your doctor about switching to loratadine, sold as Claritin, which works for allergies without crossing into the brain. For sleep, melatonin is a far gentler option. Number 8, proton pump inhibitors, Prilosec, Nexium. If you take something daily for heartburn or acid reflux, listen carefully. PP is proton pump inhibitors are among the most overprescribed drugs in the world. Many seniors have been on them for years, sometimes a decade or more. The hidden problem, by suppressing stomach acid too aggressively, PP is starve your body of vitamin B12, magnesium, and calcium. These aren't minor nutrients. They are the foundation of healthy nerve signaling and brain cell function. A landmark 2016 study published in JAMA Neurology examined over 73,000 people aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia. Beyond nutrient depletion, research has also shown that PP may increase the buildup of amyloid beta plaques in the brain, the same toxic protein linked to Alzheimer's progression. What to do? Ask your doctor about slowly tapering off PPIs and transitioning to H2 blockers, like famotidine Pepcid, which carry significantly less cognitive risk. Number 7, bladder control medications. Oxybutynin overactive bladder is a real and deeply uncomfortable problem. Nobody wants to live that way. So when a doctor offers oxybutynin, most patients say yes without hesitation. But oxybutynin is one of the most potent anticholinergic drugs prescribed today. It crosses the blood-brain barrier easily and strikes directly at the hippocampus, your brain's memory center. A 2019 study in the British Medical Journal found that seniors over 65 who took strong anticholinergics like oxybutynin for more than 1 year had a 49% higher risk of developing a dementia. The tragedy is that the mental fog, the forgetfulness, the confusion, patients assume it's just getting older. It rarely gets linked back to the medication, not until real damage has already been done. What to do? Ask about mirabegron, brand name Mirabetriq, which treats the same condition through a completely different mechanism and has a far better cognitive safety profile. Number 8, statins simvastatin, atorvastatin. This one is more nuanced, and it's important to be precise here. Statins protect the heart. For many people, that benefit is real and significant. But there's a side of the story that doesn't get enough attention. Your brain is nearly 60% fat. Cholesterol is essential to maintaining the myelin sheath, the protective insulation around your nerve fibers that allows signals to travel clearly and quickly. When you aggressively reduce cholesterol, you may also be removing something your brain genuinely needs. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 on statins for more than 3 years had 26% higher risk of mild cognitive impairment. Some patients described sudden, frightening episodes of memory loss, forgetting familiar names, driving routes they'd traveled for years, conversations they'd just had. Not all statins are equal here. Pravastatin and rosuvastatin have less penetration into the brain and are considered lower risk. What to do? If you've been on a statin for years and are noticing mental fog, don't stop on your own. Have an honest conversation with your doctor about your specific medication, your dosage, and alternatives. Number 5, benzodiazepines, Xanax, Valium, Ativan. Few drugs in medicine create dependency as silently and as effectively as benzodiazepines. They're prescribed for anxiety, panic, and insomnia. At first, they feel like a miracle. The racing thoughts stop. Sleep comes. The world feels manageable again. But what happens to your brain over months and years of daily use is the opposite of a miracle. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of Alzheimer's disease. These drugs essentially slow sedate your brain into reduced function. It stops learning as efficiently. It becomes less flexible. Neural pathways that should be firing don't. And when patients try to stop, severe rebound anxiety, insomnia, and agitation make the drug feel necessary when in reality it's become the problem. What to do? Never stop abruptly. That can be medically dangerous. Work with a physician on a gradual tapering plan. Cognitive behavioral therapy for insomnia has a strong clinical evidence and carries zero cognitive risk. Number 4, amitriptyline Elavil. Amitriptyline is an older antidepressant that's still widely prescribed, not always for depression, but for chronic pain, nerve pain, and insomnia. It is one of the strongest anticholinergic medications still in routine circulation. A massive study in JAMA Internal Medicine covering more than 3,400 adults over 65 found that those who took high cumulative doses of anticholinergic drugs like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. What makes this especially alarming the damage happens slowly and invisibly. Word finding gets harder, short-term memory slips, concentration fades, and patients are told or they tell themselves that it's simply age. What to do? For nerve pain, duloxetine or gabapentin may offer similar relief with far less anticholinergic burden. For sleep, melatonin or very low-dose doxepin is a safer path. Number 3, paroxetine Paxil. Here's something most patients and even some doctors don't know. Paroxetine looks like a modern antidepressant. It's an SSRI. It seems sophisticated and safe, but it is the only SSRI with significant anticholinergic activity, which makes it fundamentally different from sertraline or escitalopram. A 2021 review in Frontiers in Psychiatry found that elderly patients on paroxetine showed measurable declines in short-term memory, verbal recall, and attention within just 12 months, and were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The American Geriatric Society has officially placed paroxetine on the Beers criteria, a formal list of medications considered potentially inappropriate for older adults. What to do? If you're on Paxil, ask your doctor about switching to sertraline or escitalopram. Same therapeutic goal, much safer for your aging brain. Number 2, antipsychotics, Seroquel, Risperdal, Zyprexa. This is the one that genuinely disturbs me. These medications were developed to treat serious psychiatric illness, schizophrenia, bipolar disorder. They are powerful, they are blunt instruments, and today they are routinely given to elderly patients in nursing homes and hospitals simply because those patients are confused, restless, or hard to manage. A 2022 study in the Lancet Healthy Longevity tracked over 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience accelerating cognitive decline within 12 months, even those with no prior history of dementia. These drugs suppress dopamine essential for motivation, executive function, and memory. Families watch their loved one go quiet, flat, distant. They grieve someone who is still physically present. What to do? If a loved one in a care facility is on antipsychotics, ask directly, what is this treating, and is it medically necessary? Structured routines, reduced overstimulation, and proper pain management often resolve behavioral symptoms far more safely. Number 1, anticholinergic polypharmacy. The most dangerous situation of all isn't one specific drug. It's a combination most people and many doctors never see coming. Picture this. A senior takes Benadryl at night for the sleep, oxybutynin daily for bladder control, amitriptyline for back pain. Separately, each one causes modest cognitive effects. Together, they create what's called anticholinergic polypharmacy, a compounding, cumulative assault on the brain's ability to function. A 2022 analysis published in Age and Aging tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of dementia over 10 years. That's more than double. And the vast majority of those people had no idea they were even taking anticholinergic medications. No one had explained it to them. Here's the most important thing I can tell you today. Drug-induced cognitive decline is often reversible. When the medication burden is reduced carefully, gradually, under medical supervision, many seniors regain substantial mental clarity within weeks or months. What to do right now? Ask your doctor or pharmacist to review your complete medication list, every prescription, every over-the-counter drug, every supplement, and calculate your total anticholinergic burden. This single conversation could be the most important one you have this year. That's everything for today. 9 medications. 1 urgent message. You deserve to know what's going into your body and exactly what it's doing to your brain. If this video gave you something valuable, please share it with a parent, a spouse, a neighbor, someone who needs to hear this. And if you're not yet part of the Senior Health Revealed community, subscribe right now. Hit the bell. We publish new videos every week covering the health topics that genuinely matter to people over 60 without the sugarcoating. Leave a comment below. Which of these medications are you currently taking? Have you noticed any changes in memory or focus? We read everything. Take care of your brain. It's the only one you have.